Jody, and Tracy will be doing most of this presentation. And we are both Utah County Family to Family leaders. Family to Family is a statewide parent support program run through the Utah Parent Center. And we do things such as trainings, and we give resources, we give any kind of support that's needed, tips on advocacy. It is for people who are on the DSPD waiting list. However, if you're not on the wait list, of course, we'll help anyone with special needs, but it's paid through DSPD to kind of help those that are on the wait list have some type of supports. I am going to turn the time over to Tracy to start this DSPD 101. And after she talks, I'm going to just show you briefly the information on the paperwork, and then we'll open it up to questions. So go ahead, Tracy.
Hey, hello and welcome everyone. If you have specific questions or questions that just come up, please put them in the chat and Julia can be watching for those. Like Jody said, my name is Tracy. We are both parents of kids with special needs. We're the Utah County Leaders for Family to Family Network. The logos on our slides say Utah Family Voices because we share lots of things. So that just lets you know why that's there. We're here today to talk about DSPD. What is it? DSPD is, it stands for Division of Services for People with Disabilities. DSPD is a Utah-based company, and they link, or when you get on their list, when you're in services, they provide services, they provide for your children, for your families. So we're talking today about a little bit more about why should we be on the wait list. We've all heard about the wait list and how long it is. There are benefits to being on the wait list. So let's talk about waivers. Sorry, my notes are, let me see. What is a waiver? A waiver is something that you qualify, your child qualifies for, that waives your income to help them qualify for services. So they go by their disability or their needs rather than your income. They help provide services to people who would otherwise be in a nursing home or a hospital to receive long-term care, and intermediate care facilities for intellectual disabilities. So like it says, it waives the parent's income and is based on the individual's income and assets. Let me just make sure. Home and community-based services Medicaid waivers. I love all the acronyms we have in our lives, right? It's basically a waiver that provides services to help your child or your loved one to be out in the community or to be at home and taken care of so that they're not put in a nursing facility. They are, to qualify for DSPD, their disability needs to be diagnosed before the age of 18. Let's see. Acquired brain injury waiver, DSPD over 18, aging waiver, community supports waiver for people with intellectual disabilities and related services, physical disabilities, medically complex children's waiver, the Travis C waiver, and new choices waiver. So there are different waivers. There are just as many different disabilities and different ways that we qualify and help our kids get in to services. Okay, so DSPD, the Division of Services for People with Disabilities, we promote opportunities, we provide supports for people with disabilities. We want them to lead a self-determined life. We oversee them in home-based activities, and they are, let me see, services for more than 5,000 people who have disabilities. So the different supports include community living, day services, supported employment services, and much, much more. Who's eligible? Intellectual disability or related conditions, substantial financial limitation in 3 or more areas. So if your loved one has a deficit in 3 or more of these areas: self-care, receptive and expressive language, learning, mobility, self-direction, capacity to live independently, or the capacity to become economically or self-sufficient for kiddos who are 18 and over. And then there's that little note again, the onset of condition is before 18. So I maybe mixed that up, Jody, when I said it has to be diagnosed before 18. More specifically, the onset of the condition needs to be before 18. So what can be provided by these waivers? What does all that mean? Behavior consultation, chore services, companion services, day supports, financial management services, non-medical transportation, Medicaid, residential, respite. Do we all know what respite is? That was one of my first words that I had no idea what it was. Supported employment, supported living, and really any supports deemed necessary by their disability. Do we have any questions or any clarification on any of those?
And you can always put your notes in the chat as well.
Yeah.
If you have questions in between.
For sure, please, if you do have anything come up, please put it on there. So how do I apply for a waiver? This is something that has changed even since I was applying. We did the paperwork. We found the paperwork and filled it out and mailed it in and got a phone call. Right now, you can do almost everything online. And Jody will go over that a little bit. Once you fill out your paperwork, get assigned to a caseworker, they'll and get deemed eligible for Dspd, then you'll be on the wait list. Something important to remember is the wait list is not everybody sign up and take a number. It is determined by critical care or critical need, and based on your needs, as well as it's not based on your income. It's based on their abilities and their needs, which change constantly. So once you're on the wait list, you will be updated. They'll check in with you every year and update your needs and what your situation is. But something to keep in mind, anytime your situation changes, if you have a change in your child's behaviors or abilities, or if you have a change in your family life, even something that's not directly related to the child with disabilities, but something that maybe affects your ability to care for them, contact your caseworker and let them know. And that always makes changes as well. So this is the phone number to reach out. That would be the first step. If you're not on the wait list, call the phone number and just reach out, and they will send you the application, or they will direct you, or you can just go to this link that we can provide to print the application. Jody, is that link also the link to do it online? Okay.
Okay, sorry, I couldn't unmute. It kept asking me to ask
You're
for
good.
permission. This actually will tell you what you need to be eligible, and then at the bottom it should have how to apply.
Okay. I'm just looking over my notes to make sure I shared everything that I had kind of on my mind. Some of the benefits to being on the wait list, once you're on the wait list, it's not just sitting around and waiting. Now you're going to be connected with people like us, Family to Family Network, Family Voices. We are projects under the Utah Parent Center. We are moms of kiddos or loved ones with disabilities. We're volunteers, and we are Utah County. The nice thing about COVID, we've learned about Zoom, and we can all hop on. Everybody's different, all the different counties workshops and trainings and things that they're doing. We generally in Utah County have a workshop, a training, or an event every month. So we love to hear input. We do have a Utah County Family to Family Network Facebook page. We would love to have people request or ask for different trainings. If you go to the Utah Parent Center site and look at their resources, there's tons and tons. You could just spend days looking through the Utah Parent Center and finding videos and information there as well. We like to do a couple of family events a year where we get the whole family out and have some fun. We like to do maybe a Halloween carnival or an Easter egg hunt. We like to get the whole family out and kind of rub elbows and share in each other's lives and commonalities and differences, and just kind of have some fun that way. And then we sometimes have more serious workshops and trainings like this one. We were talking about DSPD. We talk about guardianship. We talk about transition. My mind will go blank because I didn't make a list of the things that we talk about, but endless topics and ideas. And we're, like I say, we're always open to questions and special requests if you have something. I definitely am not a professional, but I get to rub elbows and have lots of connections. So if you come to us with a question, if we can't answer it, we can definitely point you in the right direction and find the person who can. So if there's not any more specific questions, I'll probably turn the time to Jody and let her go through a little bit more of the paperwork side of it.
Okay, and I did see that there are some questions that I'll kind of answer. I know Julia's gone through and kind of tried to answer them on the chat as well.
Jody,
so yeah.
There is a question that I think would be good to answer from Christine. Do the waivers consider assets in a special needs trust or an ABLE account? And I think if we can take that one question before we go into the forms.
Oh yeah, I was going to answer all of the questions on there before we go on a little bit more thoroughly.
Thank you.
Yeah. So on the assets, yes, it's based on the child's assets, not the parents, but it can be used. An ABLE account is not used to look at assets. The ABLE account is for people who have special needs to be able to save some money and not have it affect their government benefits. So the ABLE account does not affect the DSPD waiver. If you have other assets, it can affect it. And the best thing to do is just kind of to ask, let people do it on a one-on-one basis, call DSPD and tell them what assets you have. And you can still get a spend down, what's called the spend down. And what a spend down does is if you are so much over, say your child is getting child support and it goes over just a little bit, maybe it goes over $100 of what it would take to qualify for Medicaid, then you would spend down and spend that $100 a month, and then they would receive all of the services. Another question was about if you have to apply for both the CSW and the DSPD. They are the same thing. So DSPD has different waivers under it. I know Tracy mentioned the brain injury waiver and the physical abilities waiver. Those are for people who are over 18, and their application is a little bit different than this application. The thing that we're talking most tonight is the community supports waiver, which is the waiver for those who have intellectual disabilities or related conditions. And if you look on this website that we have up under eligibility, then it will tell you what are the related conditions. And there's those that list that she said of what they needed to have, the expression, I'm trying to remember what they are now.
Self-care, receptive, expressive language, learning, mobility, self-direction, capacity to live independently, and capacity to become economically self-sufficient.
Thank you. Yeah, so they have to have 3 of those in order to qualify. Were there other questions, Julia, that we missed?
There were questions about other activities in the state and family-to-family network leaders, and I've added those links onto the chat about where people can find our leaders from across the state.
Okay, thank you. Okay, there is a question that was directed to me, and it asked if being on the wait list affects eligibility for SSI benefits. A couple of things on that. I'm sorry. No, these services do not affect SSI, and SSI does not affect these services. They did ask about SSDI. And I just want to explain just really quickly. So there's SSDI and SSI. SSDI is for when you have a person has worked in the community and earned so many work credits that they qualify for disability through Social Security. SSI is for those that had the diagnosis before the age of 18 and have not worked and earned credits. There's another question. How do they decide if the kids qualify for the CSW? Is it a questionnaire that parents fill out, teachers? Okay, we'll go over the paperwork and that will kind of help with some of that. So one thing that I want to mention is that if you print out the application, it will be 18 pages. And so as parents of children with special health care needs, we put those 18 pages aside because it's too overwhelming. There are only 6 pages that you have to do any kind of writing on. So don't let that discourage you. The other thing is letting you know about other services such as the family-to-family network and different things that will help answer questions for you. So in order to qualify, you have to fill out the application, and the parent usually does that. You have to have a psychological evaluation within the last 3 years, and that cannot be through the school. That has to be through a provider in the community. If they're under the age of 7, then they can have, instead of the psychological, they can have a functional limitation or a functional assessment done. And so that, sorry, I just forgot what I was going to say. So that will help with the what you need to have. You also will have a few other things that they'll ask for as you go, but that's kind of the basis of what you need. Somebody asked if there's a threshold income limit for DSPD to qualify. And for the family, no. For the child, yes. If the child is receiving funds through child support or something like that, or from a family member that has passed away and they're earning so much money every month or something like that, then that is that will be taken into consideration. And Julia just put the list or the site number again that you can look at the eligibility as well. Okay, so, and if you need help filling these out, that's what we're here for as Family to Family Network leaders. We can help do that, or you can also contact the Utah Parent Center, and they have some people that can help as well. And that is correct. Oh, I'm sorry. I'm trying to do two screens here, and so Christine, SSI does not count. The money does not count towards DSPD unless you have other income coming in. Megan asked if you've been on the wait list for 4 years now, is the psychological need to be renewed since it's over the 3 years? The answer to that is both yes and no. The answer to that is you don't need to do anything until you are about ready to come off the wait list. And then they will contact you and let you know that you need to have another psychological done at that point if it's been over 3 years. So for right now, you don't need to do anything at all. One thing that you do want to do if you're on the wait list, though, is you want to contact your intake worker and let them know if things are changing. I used to call, my son does have services now, but I used to call frequently. And usually when I was having my biggest meltdowns is when I would call and let them know how life really is. Because sometimes as parents, we kind of try and, we can do this, we've got this. But DSPD, you want to let them know how things are really, really going. Jennifer, I will go over that with you in just a minute. I'm going to go ahead and do the paperwork now, just so that you can see that, and then we will talk about the MCCW. All right, so this is just the first page. These are the things that you do need to have in order to qualify. So you've got the intake checklist. That's going to be in the paperwork that we go over. The Form 1-1 intake social history will also be in the forms. And then you will need to sign something that DSPD can contact your doctors or different psychologists or whoever that might have information that will help to show your child's special needs. And you have to have what's called an ICD-10, which is the qualification from the doctor that they have something that will qualify for these services. So these are the codes that doctors use. And so your doctor will have had to have show that code. And then again, we won't go over the acquired brain injury today. So those are the things that you need to have. So most of it is in here in the application. This is the first page of the application that tells what you need. So you do have to show, so you've got the forms, which are the first 2 or 3. You do need to have a copy of the Social Security card and birth certificate. If you have Medicaid, you'll want to show, take a picture of that and send it in as well. And also for Social Security income. And I recommend that everybody that fills out the application copies it and sends in either the original or a copy, because things do get lost. And even if you do it online, I would print it out for yourself so that you have it. You have to have the psychological evaluation done, and then also medical records that show the ICD-10. So this is the first page of the 6. So That's really, really simple, right? This is a 1-1. So this just gives the basic information of the child, the parent, the date of birth, all of those types of things, where you live. So that's page 2. That will take you just a couple of seconds to fill out. Okay, a couple minutes. The intake social history will take you the longest, but it still is pretty easy to do. You've got the person with the special needs information, the primary contact person, and if there is more than one primary contact information or person, then there are a couple of extra places you can put that on page 2. The name of the school and the contact information for the school. Any of those things that you can have ready for the person, such as the contact information of who they can really contact to get information on IEPs or through the doctors. That's good to have that information. You don't have to get all that information for them. If you have it, it's nice to go ahead and just send it in, but you don't have to have that. You can just sign the form that they can get that information for you. Any kind of education, and then any kind of history. If the person is over 16 and has worked, you would give that information there. Page 3 is, you can see under 8, there's the areas of concern. And so these are the things that you're going to kind of want to tell them briefly about why your child should be on the services. So there's mental health, diagnoses, or anything behavioral. This is where you're going to want to write if they have a lot of behaviors, if they have a lot of anxiety, anything that makes it difficult for them. Any kind of medical health or related services that that they have, if they have to see a neurologist for seizures, any of those kind of things. And you can add another paper on here if you want to write out, you can, but you don't need, you just kind of want to give them the basic information, and then they're going to call you and they're going to ask for more details. So you don't have to write the whole thing out on this. And then if there's been any kind of substance abuse used by the person, what safety factors there are for the person, if they have a really, if they're runners or things like that, you're going to want to put that. Number 9 is for brain injury, so you don't need to do that. 10 is for any kind of specialized equipment that they use, if they use wheelchairs, oxygen, anything like that. Any kind of recent hospitalizations. Any, if they've been in a ICFID or a nursing home, you would want to put that there of when they were in and the name of the facility. Any agencies that they have or you have been involved with. So DCFS, Adult Protective Services, Office of Public Guardian, Veterans Affairs, and so on. If they have any thing with these, then you'll want to write those down. Any kind of professionals that might know more information that could give them the information, you'd want to put there. If there are any kind of court orders, if there's SSI, you will report that there. And if they already have Medicaid, then you would put that there. So that is all that you have to fill out, just those 6 pages. And this you can fill out. There will be something that will look like this. Or you can just tell the worker, when the intake worker, when they call you. And so I just suggest, sometimes it's a lot easier if you don't have to actually fill it out. So that's it. It will take you less than an hour to fill out, even if you have to look up online and find doctors' information and stuff. So don't let it, be something that stops you from actually filling it out. The worry of that. So I saw there were a lot of questions that came in. Julia, do you want to tell me what they were?
Great.
Or Tracy, what they were?
So there are quite a few, and they're really great questions. So let's go back up.
Okay.
And start with this question that says, how do you know when your child is about to come off the wait list?
Okay, so a couple of things with that I want to say. They will, your intake worker will inform you. You have an intake worker from the time that you get on the wait list, or actually when you fill it out and stuff, then they will help you with that. And then you'll have an intake worker that will help you. They will contact you and let you know that you're about to be taken off. They will ask for the psychological, but if you can't afford it, they will pay for a psychological for that one. And then also, I do want to let you know that it's important to get on the wait list for a number of reasons. Sometimes, again, as parents, especially paperwork, it's just so overwhelming. So, but there's some things that can happen. So this last year with COVID, parents on the wait list or families on the wait list were offered to get paid to be a caregiver for the child, because kids were out of school and there wasn't school available. And so that was something that happened. They have times where they have a certain amount of people who will get respite for a year. And I know that's coming up pretty quickly, that they'll have a few people that will be able to get that. It also shows our legislators how many people really need it. As of right now, we have 4,000 people, a little over 4,000 people that are receiving services. And we have about the same amount who are on the wait list. But we have thousands of other people who would qualify that are not on there, and the legislators don't see that. So it's important for them to get an accurate count for that. I also just want to make sure that, you also know that there are some disabilities, such as physical disabilities, where a person's in a wheelchair, that they may not qualify and be eligible. So make sure that on that eligibility page that you are going through and kind of really looking at that before you fill out the application, because this is for people who have intellectual disabilities or related services. So just because they're in a wheelchair doesn't mean they won't get it, but they need to have some of those other things as well as the mobility.
Can I add a couple things to that, Jody?
Of course.
So on that link that we added about Utah, dspd.utah.gov/eligibility, it lists those 7 areas. And again, people need to be found eligible in 3 of those areas. We have an additional video on the Family to Family Network webpage that goes into a little bit more detail. We don't have the time here, but goes into a little bit more detail to describe those 7 areas. And we can add that link. It's a 25-minute video, but talks about what each of those areas mean, including self-care and learning, self-direction, and language. So to get a little more description there. The other thing about being on the wait list is, along with the caregiver compensation, which is what that was called during COVID, that was CARES Act money, people received personal protective equipment, which was masks and gloves and hand sanitizer. They also received ways to keep in touch with a tablet. So when people were meeting by distance, that they had ways to stay in touch for their healthcare and their mental health care. There's sometimes short-term ways for people to receive support for employment, or during transition years for people on the waiting list. So there are things that come for people on the waiting list. And then there's the connections that can be made with other families. And our son was on the waiting list for 13 years. We're working really hard to have that not happen for other families, but the connections that are made is also what can come. So I know people are saying, what is happening for people on the waiting list? Those are a few things that have happened recently and historically. So that is a couple of the other pieces. Thanks, Jody.
No, thank you. I'm glad that you mentioned that. And also reach out to your senators and your representatives and let them know your story. Let them know that why it's important for you to have these services and how it will help your family. And because they need to know that. And the last 2 years, they actually have not approved anybody coming off the wait list. And they're the ones that do it. Dspd, if the director of Dspd could, she would do everyone that's on the wait list. Like, she understands the importance for the family, but the legislators need to know that's who you need to talk to if you're feeling frustrated about the wait list. Okay, Julia, what other questions do we have?
Okay, we have a question about, my child already has the MCCW, which is Medically Complex Children's Waiver. Will there be any information covered here that I don't already have?
So we really don't have a lot of information here on the MCCW. This is for children who have at least 3 different organs that are affected with their disability, and have 3 different specialists for their children, and it only goes to the age of 18. So the one thing I will say is that if you are on the MCCW, you'll want to make sure that DSPD knows when the child turns 18 and that you don't have those services anymore. If you have specific questions, call the Utah Parent Center and they can help you with any questions that you might have of the MCCW, or if you want to stay on after everybody else is gone, you know, I'm happy to, or Julia or Tracy can help answer some of those.
Okay, the next question is, can the diagnosis code that UCD-10, I think that's it, code be old, like 15 years old?
So it can, it's probably good. It can be 15 years old. It's probably good if you have something from your current physician that can kind of help collaborate some of that, and just have, you know, because there may be more things that have come up. It may have started with autism and then it had, you know, a lot of anxiety, or, you know, different things that may have come up that may be affecting. So it's good to refresh it, but you can turn in something from 15 years ago.
We've also had that question, like for a child who has Down syndrome. Down syndrome is a lifelong diagnosis, so it's going to come at birth, most likely. Yes, that's your code for life. So having it current though as well. I love that question.
Yeah. All of these are great. And if we're not answering them to what you're really thinking, just unmute yourself and say, hey, I have a little bit more, but I don't understand this, or write it in the chat.
Yeah. Okay, the next question is, psych evaluation is for every child, no matter what, right? Even if severely disabled and nonverbal.
That's correct. And they do a lot of the application, or a lot of the psychologicals that come in will say from the psychologist, sorry, will say, you know, we weren't able to get a lot of information from the child. This is to the best of my ability to know what, and the parents answer what questions they can. On almost all child psychology reports, it will have, the parents will have a big input on what is said for that. And sometimes the teacher will be asked to fill something out as well.
Okay, Jody.
Yeah.
That was something that was really scary for me. My daughter's 21. We are still on the wait list. And we did this pretty recently, within the last few years, a psych evaluation with a psychologist. And I was kind of nervous going into it thinking, how's my daughter going to have a psych evaluation? She can't even communicate. He was amazing. And he sat down with both of us. He asked me to just leave the room, like just out of her sight, and visited with her. And then I came back, and it was so comfortable, and it ended up being a really good experience. So that was something I was kind of scared about, and it turned out being really good. So don't overstress things.
Yeah, that's awesome, Tracy.
Yeah. Next question is, if your psych eval is over 3 years, do you need to get a more recent eval before you are put on the wait list, or should you wait until you are about to come off of the wait list to get a new eval? Good question.
Yeah, so if you're not on the wait list, you have to have a psych evaluation in the last 3 years. If you can't afford it, again, you can talk and see, to Dspd and see if they can help with that. Sometimes they can, sometimes they can't. It just depends on the funding that they have. But they do request a psychological in order to get on the wait list.
Okay. Next question is, they only would want to know if my child has been involved in DCFS, right? Not if we worked with them while providing foster care to different children.
That's correct. Those questions are for the child themselves, basically. So, yeah.
Yeah. Does the involvement with DCFS still apply if it involved a child not applying for DSPD?
That's a good question that I'm not completely sure about, but the questions on the application is not about the parent, it's about the child. And so I would suspect that it would just be for that child.
Yeah.
Is that what you'd say, Julia?
Yeah, I would agree with that. It's only about the child. They're only
Yeah.
asking about if it's been involved with the child. Okay, next question. Do you have suggestions about effective methods for contacting our legislators? Emailing doesn't work at all, and calling them just seems to go to phone mail. Should we visit their offices?
Yeah, so there's a couple of different things that you can do with that. I have visited their office. Going to the one day that they have for DSPD is good to go up to the legislation if you can. They do have more options now that you can do it online, which makes it easier. I've invited our personal legislator to our house. I invited a few different families, and so that it wasn't just, he was just spending time with me, but he was learning from a few different people. That's a great way because he saw all of our medical equipment. He saw what our household kind of ran like, so that was a good way to do it. You can ask to go to see them at their office. You can also, when they're in session, you can go up to the Capitol, and you can ask for them to come out in between voting, and they can come out into the hallway, and they'll probably only spend 3 to 5 minutes with you if you do it that way, because they need to get back in there and do their voting. But that is another way that you can do that. Julia or Tracy, do you want to add to that?
Tracy just shook her head.
That is something that I would like to. I know we just had a training, and we had a form letter to help us fill out and everything. That is something I need to follow up on better and be better at. So I appreciate that question.
If you're not familiar with who your legislators are, you can go to le.utah.gov and go to the tab on the bottom right that says My Legislators. You put in your zip code. Sometimes you need to put in your full address. That will give you information on their full address, their phone numbers, their emails. I just did this with a friend actually 2 days ago. She found out her legislator lives 2 doors away from her. She's going to go knock on their door and say, hi, this is the current need for my daughter who's in services, who just had to come home for 11 days because we don't have enough people who work in the disability field. That is another way to do it. our legislators knew our son and came to our home as well. They're very busy individuals. We do have things on the Family to Family Network or Utah Parent Center website. There is also, we can put other links into Legislative Coalition for People with Disabilities. They'll help you get in touch and help do advocacy work. Disability Law Center is another great way to get involved with doing advocacy work and finding ways to talk to legislators. This is a start because they might be your neighbor 2 doors down and be like, wait, I just talked to them about their goats. And that's really what happened with my friend. So this is a start. I can put those other links in as well. Please,
Awesome.
please
No,
do.
go ahead.
No, that's all.
That made me think of a couple of different things. Tracy mentioned the form letter. I did have a legislator that told me that if somebody can't write their own story, then they're not going to take the time to read it, that they want to know what's really happening and not just everybody said the exact same thing. I'm not saying that it's a bad way, and if it's the only way you can do it, that's great. Make sure that you write something on there though of personal experience. Don't write a 3-page letter. Try and keep it as short as possible. If you do email them, some do read them. Some read every single one. And you can also just call their office and tell the receptionist that answers or the person that answers what you want them to know. And you don't have to actually talk to them. I also just want to mention, since Julia brought up the LCPD, Legislative Coalition for People with Disabilities, the entire time that they're in session, they are looking at all of the bills that are for people with special needs. So it's a really great organization to get involved in. And I know Julia is going to put that up in the chat, but just letting you know what they do.
I'm looking for them all right now. So another question, let's make sure we get to our questions. Does Family to Family Network have a list of providers that take Medicaid and that can provide psych and other evaluations required by the application?
Great question. We don't really have a list. They usually go through Valley Mental Health with Medicaid. I suggest that you contact your provider, your Medicaid provider. So whether that's Healthy You, Select Community, what are the other two? Molina, I think that's actually all that there is now, and Traditional. Contact them to find out who they specifically do, because they all will take different providers than each other. So that's the best way to kind of check on that.
So that catches us up with the current questions. Are there any other questions about the application or what to do while you're on the waiting list? Jody, anything else you want to add about anything? Tracy? Anything else?
I do. I just want to recap and just say, don't get frustrated. We've been on the wait list for 12 years. My daughter's 21. We're functioning. I check in with, I have my intake worker's name in my phone. I know her name and we chit chat a little bit. She is finishing up her last year of school, and that means life will change drastically for us. And so we're looking on to the next thing. But I have greatly appreciated the Utah Parent Center immensely, and getting to know Family to Family Network and the different projects under them. Just jump in there, get some support, some, rub your elbows. We share knowledge, we share experiences. Sometimes we just share fun. And that alone is a huge benefit of being on the wait list. Just being able to look out and see how many other moms are maybe in our same boat. So I just did want to mention the different tools that the Utah Parent Center has, charting the life course and autism. What is that one called? The autism across the lifespan. And I know that one is still growing and evolving. There's tons of resources out there. You just have to look or ask or be, come on board. And I think the more we get together and the more we train and the more information we share, maybe the more questions we have, but it eventually leads us in the right direction that we need to be for our loved ones. So
That's good. And also, with us, we were on the wait list, and I expressed to my wait list worker that my stepmother had passed away, and she was the only one that really gave me additional support, other than my husband and stuff. And so, I mentioned that to them, and we were taken off shortly after that. It was a good year to get off. A lot of people were getting off that year, but let them know when you're not going to have supports. Once you're actually on the wait list, you're going to want to focus on the things that are difficult for you to care for the child rather than the child themselves. Although you want to, of course, let them know if there's behaviors or if there's, they're in the hospital a lot, whatever. But what a waiver was made for, it started with the Katie Beckett waiver, and Katie Beckett was in a facility, and Ronald Reagan, her mom had talked to Ronald Reagan and said, I just want to bring her home. Like, we want to be able to have the help to keep her home. But, and that's how a waiver came about, it's to help the families be able to be successful with their child and not have to go into a facility because they're, the family isn't able to do so anymore. So, so really let them know when things are happening. Let them know if you go in the hospital or, the other parent, anything like that.
Can you tell me?
Yeah.
I have a question. Can you tell me where I find the parent caregiver timesheets? I've done this for so long now, but I can't find where I originally printed off my timesheets.
Okay, it depends on who the fiscal agent was. So if you went with Acumen or
Leonard is
you went with
my
Leonard. So Leonard Consulting does have a website that actually has the timesheets on there that you can print off.
the parent.
Or, I mean, not the
guardian.
parent center, the parent timesheet or the timesheets. They have it where they can, or you can contact Leonard Consulting.
Okay, because
and
I'm
ask.
only finding my employee ones, but not the parent caregiver one.
You can just cross off parent employee and put caregiver.
Okay, thank you.
Of course. Any other questions?
So another question that I've often heard is, so what do you get when you come off the waiting list? Like, why are we waiting anyways? And do you want to tell them about the meeting next month that may help demystify? Because, like, why are you waiting anyways?
Right. So I'm always amazed that people have been on the wait list for 15 years, but they don't know what the services are. They just were told to get on. So next month, February 1st, we will be having another meeting, Dspd 202, and that will be for people who have just gotten off the wait list. What happens, what services are available, how you find a support coordinator, what a support coordinator is, why you need one. All of those types of things will be answered. And Lisa Wade and I just forgot her name, Julia. Corinne.
Fraser.
Lisa Wade from the Utah Parent Center, who is also one of the people at the Parent Center with Julia that oversees the Family to Family Network, and Corinne is a support coordinator. So that will be a fantastic one. And again, if you look at the Utah County Family to Family Network page, it will have all of the information. You can go to the Parent Center, utahparentcenter.org, and they'll have the information as well. If you're not on their email list, you may want to sign up for the email list to find out what all is available through the Parent Center. They have all kinds of trainings. They have transition trainings. There's one coming up in Utah County for transitioning out of preschool. So there's all kinds of things going on all the time.
There is a specific question. Do you see the question there, Jody, or would I?
Yeah. Yep. I just saw it pop up.
Okay.
What support or services are available for adults with high functioning autism by being on the Dspd waitlist or CSW? So you have to go to that eligibility site and see what is specific to your child, if they would qualify for CSW or the Dspd. So if they have a hard time with receptive language, you know, understanding what's being told to them, or they have a hard time expressing themselves, that may be one of the things. They may be over the age of 18 and would not be able to work enough to support their child. That would be another one, or not their child, to support themselves. That would be another one that might be on there. So it just depends on your child. But if you're looking for resources for adults with special needs, high functioning autism, you can also call the Parent Center and ask for Utah Family Voices, and they can help you to see what other resources are available as well. That's a hard one because there's, you know, it's just as difficult, but not as many services for children who are kind of more on the high functioning end of the spectrum.
Okay. Any other questions? Any other resources we can share with you tonight?
I will just mention, since she talked about an adult with high functioning autism, there is the independent living centers that are throughout the state as well. They do different programs. They have different classes like cooking or crocheting, or they go bowling. They do different things. That's, you know, you could find the independent living center in your area, so that if you're wanting them to get out and be with other people. If you're in Utah County, RAW, recreation and habilitation, and I don't remember now if it's Orem or Provo. I think it's Orem. They do activities. So there are things around to have for people that are adults with special needs as well, to get some socialization. Any other questions? All right, well, we really appreciate you joining us tonight, and hope that it was helpful. And if you have more questions, call the Utah Parent Center or join the Family to Family Network in your area.
Okay, thank you so much.
Thank you. Have a good night.
You too.